high-flow nasal cannula oxygen therapy reduces neuroventilatory drive and work of breathing in post-extubation COPD patients. High-flow nasal cannula oxygen therapy is known to improve oxygenation and reduce the work of breathing in hypoxemic respiratory failure. Previous studies have established the efficacy of high-flow nasal cannula oxygen on gas exchange and the work of breathing in a home care setting in stable chronic obstructive pulmonary disease patients. The study was conducted to compare the effects of the high-flow nasal cannula oxygen therapy with the conventional oxygen therapy on post-extubation neuroventilatory drive and work of breathing. Patients with a background of moderate severe chronic obstructive pulmonary disease who were admitted to the intensive care unit were enrolled in the study. Individuals who required mechanical ventilation for acute hypercapnic ventilatory failure of various etiologies were also included. The patients who were less than 18 years of age, in whom invasive mechanical ventilation was done less than 48 hours ago, who had a tracheostomy, were excluded from the study. Patients contraindicated to the insertion of the electric activity of the diaphragm catheter, who had concomitant neurological or neuromuscular pathologies, or with paradoxical abdominal movements, or used accessory inspiratory muscles, were not included. The study was a single-center, unblinded, crossover trial, which included 14 chronic obstructive pulmonary disease patients. After extubation, the high-flow nasal cannula oxygen therapy was given twice for an hour, alternating with the conventional low-flow oxygen therapy for an hour. The parameters recorded were gas exchange, breathing pattern, neuroventilatory drive in terms of electrical diaphragmatic activity, and work of breathing in terms of inspiratory transdiaphragmatic pressure time product per minute, were recorded. Upon switching from high-flow nasal cannula oxygen 1 to conventional oxygen therapy, the electric activity of the diaphragm peak increased significantly, followed by a significant decrease in electric activity of the diaphragm after switching to high-flow nasal cannula oxygen 2. Thus, the high-flow nasal cannula oxygen therapy significantly decreased the post-extubation neuroventilatory drive. The pressure time product per minute increased significantly upon switching from high-flow nasal cannula oxygen 1 to conventional oxygen therapy, and it decreased significantly upon switching to high-flow nasal cannula oxygen 2. Thus, the high-flow nasal cannula oxygen therapy significantly decreases the work of breathing. Based on the results, it was concluded that the high-flow nasal cannula oxygen therapy significantly decreased the post-extubation neuroventilatory drive and work of breathing in chronic obstructive pulmonary disease patients.